As we start getting colder weather, many seasonal illnesses will be responsible for students being out sick from the classroom. So what are some of these bugs to watch out for? To help answer that question, I'm joined by Dr. Dina Kulik, pediatrician and founder and CEO of Kid Crew. Dr. Kulik, thank you so much for joining us this morning.
Welcome.
Okay, the question that we have to start with is, in your capacity, have you been seeing an increase in kids being absent from school?
There certainly have been a lot of kids that we've been speaking to and seeing in person at the clinic in the last couple of weeks. But remember, it is a typical viral season. When school starts, we're indoors more often, we're in close quarters more often, and this is when viruses tend to spread more easily.
Okay, and we know that COVID is the biggest conversation happening now, but are there any back to school illnesses that parents should be aware of other than COVID?
Absolutely. Kids are still getting COVID as are adults, but we see influenza starting to creep up, lots of other viruses like stomach flus and pink eye, and many different viruses that cause cold and flu-like symptoms.
No doubt a stressful time for parents. Are there any tips or things that they can do to prevent some of these illnesses?
Absolutely. Like with COVID, all viruses like to live on surfaces or spread with droplets in the air. So keeping distance when you can, staying home if you're sick would be helpful to prevent the spread to other kids in the class and teachers and administrators and other people in the school setting. Keeping very clean hands, because when we touch surfaces that have droplets from these viruses, whether it's a stomach bug or a cough or a cold, and then we touch our face, that's a point of entry for those viruses to then infect you.
How do you have that conversation with your child, especially if it's a young kid? What kind of what advice do you have for parents to kind of have that one-on-one chat with them?
Yeah, it's a great question. I like to think of germs, bacteria, viruses as little things all over our hands, little germs, little bugs. And I like to think about sparkles. So, if you have sparkles on a card or on a hat or on a shirt, they kind of get everywhere. That's the description I use when I talk to my own 4 kids or other kids. They get everywhere and they can be difficult to remove from your nails or, from the crease in your hand. So we want to make sure that we're washing all the surfaces of our hand, our fingers, our thumb, in between our fingers, the back and the front. So when we're picturing wash our hands well, washing all of those surfaces to remove those sprinkles, which are the germs.
I like that explanation. It's quite visual and it's easy for kids to remember. Something else I wanted to ask you is, anecdotally, we've been seeing these photos of empty shelves, parents concerned that they're not able to get their hands on Tylenol and Advil. Is there anything parents can do to be able to get the medications they need for their kids?
For sure. So a lot of pharmacies do have stock of these medications, but they are behind the shelf. They're with the pharmacist in the area of the pharmacy that they are working. So it's always wise to touch base with your pharmacist and see what products they have. And depending on the weight and the age of your child, there are often alternatives you can use. So you don't always necessarily need to use a liquid preparation. Chewables may be appropriate. Or further, older kids might be able to swallow a medication that you wouldn't expect for a younger child based on their age and weight. So it's very, very important that you touch base with your healthcare provider and tell them the age of your child, the weight of your child, because they can tell you the best dose to give and what the options might be if you're not able to find the medication you typically use for your child.
And Dr. Kulik, vaccine uptake in the youngest age group, we're talking 6 and under there, is significantly low. Is there a reason why that is?
What I hear from a lot of families is they're not as concerned or worried about COVID anymore because it typically does present as a mild flu-like illness for most children. There are not a lot of children getting very sick with it. That being said, some kids do unfortunately get very sick with COVID or have symptoms that are challenging in the moment, or also symptoms that last longer after the illness is mostly gone. So I do encourage families to get the vaccine. A lot of kids too have had the illness, and some of them recently. So parents don't think they need the vaccine because their child has already had COVID. So again, it's wise to touch base with your healthcare provider and review when your child had COVID, if they had it, or what exposures they have, and also what risk factors they have, because some kids are at increased risk of getting more severe complications with COVID. So it is wise to touch base with your healthcare provider and review your child as an individual and what the benefits might be to getting the vaccine for them.
Yes, and that's where you can also get some much needed questions answered. Dr. Dina Kulik, thank you so much for joining us this morning.
You're welcome.